Hi, this is Dr. Mitchell Yass here. In this episode, I want to review a response I was making to somebody on Reddit. There was something that I had pointed out in one of my posts regarding the baseless use of the MRI and the fact that in more than 98% of cases, the cause of pain is muscular. The person asked me to provide documentation to reaffirm my position. And when I went to put the information on, it didn't allow me to put this on the site. And I thought that that wasn't reasonable, as if people are asking for validity in information, I think that if there is documentation, it should be allowed. So I thought the best thing to do was to do a video and present the information and then present the video on Reddit. And that way, this person will have the opportunity to see why I am so 100% sure that the use of the MRI is baseless, that in fact, in more than 98% of cases, you will be misdiagnosed by getting an MRI finding. And that in fact, 98% of cases, the cause is muscular. So I thought it'd be great for people, and maybe you're not on Reddit, maybe you just go to YouTube and you see this. If you want to understand why the MRI is baseless, this is the documentation. And this isn't everything. This is just a pretty good amount of information to understand why you should basically disregard MRIs in identifying the cause of your pain. I break the understanding of the failure of the MRI into three categories: theoretical, clinical, and scientific. And then I explain the theoretical and clinical presentations as to why muscle can be seen as in 98% of cases causing pain. So basically, we talked about the fact that we're going to break the presentation up into two categories. First, the MRI being baseless. Second, the fact that in more than 98% of cases, the cause of pain is muscular. So when we look at the MRI, the first thing we want to understand is that the MRI was invented to identify tumors in the brain. I'll say it again. The MRI was invented to identify tumors in the brain. It was not invented to identify the cause of pain. It was simply implemented with no studies performed to validate its accuracy. It simply got implemented. That's the first thing to understand. So there was no testing done. There was no proving that there's this direct causation of structural variations to the pains being experienced. The MRI was created for some other usage and then implemented without study. Now, we'll start with the theoretical basis of the use of the MRI and why it's baseless, relates to the idea that the MRI is based on the proposition that if somebody is in pain and seeks care, an MRI is performed and finds a structural abnormality like a herniated disc, stenosis, pinched nerve, meniscal tear, compression fracture, and the alike. And since the abnormality is identified at the time of the pain, it is asserted to be the cause of the pain, right? So you have pain, an MRI finds a structural variation. Since it's found for the first time at the time of the pain, it's asserted to be the cause of the pain. This concept is known as correlative theory or junk science. It simply postulates that if A and B occur at the same time, A causes B. For instance, if I open my front door when the sun rises, I can say opening the front door causes the sun to rise. Based on this principle, if the MRI found I had two elbows at the time of pain, which I do, it would then be able to say that having two elbows is the cause of the pain. Clearly insane. Just as insane as it is to assert a structural variation identified at the time of pain is causing the pain simply because it's identified for the first time at the time of pain. Clearly, correlative theory is valueless and proves nothing. The identification of the abnormality at the time of pain simply identifies that they exist at the same time, not that one is causing the other. Correlation and causation are two completely different things. What we're looking for in terms of treating your symptoms is to establish the cause of the symptom, not to simply identify something that happens to exist at the time of the symptoms. Okay, let's go down to the next page. Relating in that vein, there is no way to confirm whether the structural abnormality existed before the pain began. Since pain begins at inception of distress in tissue, eliciting the pain, the distress of the tissue must occur at the same time as the pain begins, right? So what we say is that what's the purpose of pain? Pain is to create recognition of distress of tissue. So the pain begins initially at the inception of distress. When the tissue begins to break down, it begins to elicit the pain. If the abnormality existed months or years before the pain, then by definition, it could not be the tissue in distress eliciting the symptom, the pain. So, for instance, let's say your pain began 2 weeks ago, and someone does an MRI and says your back pain is from a herniated disc. Well, what if it was able to be shown that that herniated disc began 3 months or a year or 2 years ago? How can someone say that that's the cause of your pain that began just 2 weeks ago? Whatever's causing your pain went into distress 2 weeks ago at the time you began to get your pain, right? Inception of distress when the pain initially begins. So if something existed 2 years or 3 years or 5 years ago prior to the inception of pain, it can't be the tissue in distress eliciting the pain. This is straight logic. It's irrefutable. What I'm saying cannot be refuted. It is the way the body works. You have to accept it as fact. It doesn't matter if someone says it's not fact, it is fact. Unless they can refute it with some scientific evidence, then it's fact. Someone saying it's not fact doesn't make it not fact. You got to be able to look at science. That's what I did. When I started this method, that's how I figured the method out. By interpreting empirical evidence. What is what I then began to explain. Next, let's look at the premise of the hypothesis. For every hypothesis to be true, there must be a null hypothesis that is true as well. So let's take back pain. It is said that an identified herniated disc causes the pain. This is the hypothesis. Herniated disc causes pain. What is the null hypothesis then? Those without back pain do not have herniated discs. So if herniated discs cause pain, the null hypothesis has to be that those without pain don't have herniated discs. For the hypothesis to be true, the null hypothesis must be true. This is the law of science. This is how all fact is determined. Every time a hypothesis is created, they will also create the null hypothesis. In real life, in empirical findings, in what is, you must be able to show that the hypothesis is true and the null hypothesis. Well, if herniated disc cause pain, therefore, those without pain should not have herniated discs. This was refuted in 1994 when the first study ever performed on people without back pain was performed and showed that 70% of those without back pain had bulging or herniated discs. Clearly, the null hypothesis is not true. Therefore, the hypothesis is not true. Therefore, you cannot say that herniated discs cause pain. Fact. End of story. This is the way science works. I don't care how many physicians you go to. I don't care how many people tell you something. This is the law. This is scientific method. Hypothesis, null hypothesis. You must meet both for fact to be created. Clearly, this is not true. To reinforce the point even farther, one study was done on the premise that meniscal tears in the knee causes pain. Therefore, the hypothesis is meniscal tears cause pain. The null hypothesis is those without pain should not have a meniscal tear. A study is performed and shows that 63% of people with meniscal tears have knee pain, while those without knee pain, 60% are found to have meniscal tears. Where's the presentation of the hypothesis and the null hypothesis? It fails again. The hypothesis is meniscal tears cause pain, knee pain, therefore nobody without pain should have a meniscal tear. Oops. 63% with pain have meniscal tears, 60% without pain have meniscal tears. Not fact. Meniscal tears do not cause pain. End of story. I don't care how many people are found with pain and meniscal tears. It means that clearly another tissue in the area is eliciting the actual pain you're experiencing, and the meniscal tear is an independent variable to the cause. It just happens to be found because the MRI is performed at the time of the pain. But it is not eliciting the pain. It is not the tissue in distress. Fact. This is extremely damaging evidence to the theoretical basis that the MRI is the cause of can identify the cause of pain. This is small compared to the clinical evidence. So now we're going to go on to the clinical evidence. Okay, so we just did the theoretical evidence. As it is at this point, it is proved factually that the MRI cannot identify the cause of pain. Now we're going to go on to the clinical presentation. If we are to say that the MRI identifies the cause of pain, then it would have to be said that the symptoms being experienced must match where they should be if the identified structural abnormality were to create pain. This concept reinforces the idea that the tissue in distress elicits the very symptoms being experienced as part of the emergency feedback system of the body to alert you when a tissue is not working properly, so an intervention can be performed to resolve the distress of that tissue. And once resolved, the tissue no longer has to emit the distress signal of pain, and it ceases. So we're recognizing that every tissue creates a very specific symptom as part of the feedback system of the body to make sure you become aware that particular tissue isn't working. You can get the intervention, resolve the stress of that tissue, and it no longer has to elicit a symptom. That's how the system works. So every cause, specific symptoms. Symptoms created by specific causes. So I hope nobody's doubting this aspect of the reason pain is experienced. For instance, the typical indication of a heart attack is pain at the chest and the left arm, not ankle pain or knee pain, which is why if someone gets pain at the chest and the left arm, they assume they are having a heart attack and seek care, right? So that's the way the system works. So now we're going to look at specific symptoms. So if the symptoms experienced don't match the exact location where they should be, if the identified structural variation were to create symptoms, then clearly the symptoms being experienced couldn't be from the identified structural abnormality. And therefore, the structural abnormality is an independent variable to the cause of the pain. So now we're going to look at specific situations. A person has pain around the kneecap. This is an extremely common phenomenon. An MRI is taken and finds a meniscal tear. The person is told that the meniscal tear is identified. And since the meniscal tear is identified at the time of the pain around the kneecap, it is established to be the cause of pain. And therefore, the person is told they need surgery of the meniscus to resolve the knee pain. The problem with this assertion is the fact that the knee joint is comprised of actually two joints, the joint between the thigh bone and lower leg bone, and the joint in the front between the kneecap and the thigh bone. The meniscus lies in the joint between the thigh bone and lower leg bone. And if it were to elicit pain, it would create pain at what is known as the joint line, the space on either side felt on the outside of the joint between the thigh bone and lower leg bone. That's where a meniscal tear would have to create pain if it were to elicit pain. The problem is that the pain that's being experienced is in the second joint, the joint between the kneecap and the thigh bone. That is a completely an independent joint. Therefore, it is impossible for the meniscus to create pain around the kneecap. End of story. End of story. No questions, no confusion, no rebuttal. It's a second joint. It's an independent joint. If you want to say, well, it can refer it, then you're going to be willing to say arthritis at the elbow creates pain at the ankle. You could say that. Anyone could say that. But if you're interested in science and the way things work, then you have to recognize that structures of a joint can only create pain at that joint where the structure exists. It's just obvious. So therefore, the identification of the meniscal tear has to be perceived to be an independent variable to the cause of the pain around the kneecap. End of story. Now we'll take another one. How about the person who has pain 3 inches off to either side of the spine in the lower back, and an MRI finds a compression fracture of the L4 vertebrae? And since it is found at the time of the pain, it is asserted to be the cause of the pain. What's wrong with this? The problem here is that the compression fracture at the vertebrae would only cause pain at the fracture site of that particular vertebrae. It doesn't have the ability to refer symptoms 3 inches off either side of the spine. Anyone who knows anything about a fracture knows the pain you're going to get from a fracture is at the fracture site of that particular vertebrae, the L4 vertebrae. That's it. So again, I don't care if you find an L4 compression fracture when you have pain 3 inches on either side of your spine. It can't be creating the symptom. That's not where the symptoms would be if the fracture were to create symptoms. End of story. This is the way it works. That's how your body works. Okay? So that can't be the cause. It's an independent variable. Here's one more. A person is having pain that runs down the side of the leg and also has pain in the front of the thigh. An MRI finds arthritis at the hip joint, and since it is identified at the time of the pain, it is asserted to be the cause of the symptoms. The problem here is that the arthritic change in the hip joint is only going to create pain where? At your eyeball, at your ear, your tongue? No, the hip joint. That's where you would find pain. And to confirm that, you would have the person lay on their side. You would push down on the head of the thigh bone, push it into the hip joint, and try to incite the pain in the hip region, in the hip joint itself. But that's not where this person's complaining of pain. Their pain is at the side of the leg and the front thigh. So just because arthritis of the hip joint was found at the time doesn't mean that's the cause. It's insanity to make that statement. For arthritis at the hip joint to be causing pain, the pain that must be experienced is at the hip joint. Any pain beyond that couldn't be from the arthritis. I don't care. I don't care if you want to discuss the intensity of the arthritis. I don't care about any of that. None of it means anything. Symptoms created by tissues are where they should be if the tissue is creating symptoms. If symptoms experienced that aren't where they should be, if a tissue identified is creating symptoms, the identified tissue isn't creating those symptoms. That's the way this works. By the way, in all three of those cases that I just described, those are the front thigh muscle probably being too strong in relationship to the hamstring, causing excessive pulling on the kneecap, which is why you get pain at your knee joint around the kneecap when you bend your knee. The lower back QL muscles, quadratus lumborum, sit 3 inches to either side of the spine. So those are probably straining because something has caused them to shorten. Again, a muscular cause. And here, the pain at the side of the leg is probably a strained gluteus medius muscle. And the front thigh pain is the quadricep compensating for the weak glute med muscle. Every one of those examples, clearly those symptoms represent where the symptom would be if muscle was creating your symptom. Oh, that's right. Those three muscular causes don't show up on diagnostic tests like MRI, nor do any muscular causes. So if you have a muscular cause, you could pretty much be guaranteed it will not be identified on an MRI, which means there's a shitload of misdiagnosing going on. And those people you're going to read and interpret the MRI are uneducated. to identify muscular causes, reinforcing the problem that if you have a muscular cause, you can't get it identified by seeking care from someone who interprets an MRI. This is the science. This is an opinion. This is fact. This is real empirical evidence. This is indisputable. So those are just a few examples of the types of clinical presentations that would indicate that the structural identified cause or the structurally identified abnormality is not causing the symptoms being experienced. So now we'll just go on to the scientific evidence. I already gave you a couple of studies. Well, here's another one, and this would blow people's mind. Lots of people are diagnosed with degenerative disc disease as the cause of their lower back pain. One study showed over the age of 60, 90% of the population who has no back pain has degenerative disc disease. 90%, pretty much everybody. So which is the possible cause of your pain? There is a magical type of degenerative disc disease that causes pain, or you're one of everybody else, like everybody else who has degenerative disc disease that doesn't cause pain, and there's just another tissue in the area that's adjacent to the spine eliciting your pain, and you happen to just find the degenerative disc disease as an independent variable because the picture was taken and it showed up. Which makes more sense? Clearly the latter. Okay? More information to prove it. In the Cleveland Clinic Arthritis Advisor newsletter, they straight out pointed out, this is an exact quote, most back pain is muscular. In 2007, the American College of Physicians put out a position paper that recommended MRIs not be used to identify the cause of lower back pain after performing a 20-year literature search. That's 20 years of case studies they reviewed, hundreds of thousands of case studies. And what they established is that of the people seeking care for lower back pain coming to primary care, 85%, the vast majority, they put into this basket called nonspecific back pain. That means that they couldn't find a knife in the back, or there was a bone sticking out, some very obvious structural abnormality. So of the people seeking care for lower back, 85% were nonspecific. Then they looked at the use of the MRI to try to reach a positive outcome in resolving the back pain. And what they found is that it did actually 0% improvement in outcome by using an MRI to try to correlate the pain to a structural abnormality. Worse off, they found that the use of the MRI led to unnecessary treatments, including surgeries, and unnecessary costs, additional costs. So that's not just me saying it. We have the American College of Physicians. So that kind of pretty strongly recognizes why the MRI is baseless. This is basically irrefutable, indisputable evidence. No one can say anything I said is not true. It's pure. It is exactly how the body works. It is based on logic. It is based on the scientific model. So in terms of the MRI, I don't think you could get a clearer picture why you should never, ever trust it. And hopefully it gives you an understanding why magically structural variations are identified every time someone shows up with pain. Lots of other things can show up. Lots of other things can show up. I can show that your shirt isn't buttoned at the time you're having pain. Does that mean not having a buttoned shirt causes pain? I mean, you have to recognize that the principles of correlative theory do not show causation. Things like having the proper symptoms to a specific cause, that shows causation. But simply showing a structural abnormality showed up just because you happen to be pain anywhere in your body, that doesn't mean anything. That's called correlative theory or junk science. So as we go to now the understanding of why 98% of cases are muscular, you have to kind of look at a historical perspective to understand the situation you find yourself in today. And here we recognize that chronic pain has never existed in the history of mankind. Never, ever in the annals of medical history of mankind. It only began in the late 1980s, early 1990s. Well, what were the key factors that brought that on? First, this period, prior to this, the typical group of people that was suffering from pain were typically the elderly, right? The retired person. They would call it rheumatism, right? Well, what happened at the time of retirement? The person stopped working, stopped being active. So what happens? You weaken and you become more susceptible to straining your muscles when you're going to try to do activity, right? You end up sitting more, makes you also more susceptible to straining and having pain, right? So that's why that was true. Typically, it was the older retired person, right? Then we have the late 80s, early 90s, where automation comes out, where we have the use of technology and computers and phones. And all of a sudden, the average manual job is being replaced with automation and technology. And we have people doing less physical stuff, even sports. And I mean, the classic example, the way to see it is the kid when we used to finish school or on the weekends, we played football. And now you have kids today playing Madden football right on their computer. They don't use their bodies at all. Well, what you start to notice is this use of technology now has more and more people of all ages starting to weaken and become more susceptible to straining their bodies. So instead of it just being a bunch of 60, 70, and 80-year-olds, now you have people all the way down to the 20-year-olds starting to suffer with pain. So we have this massive growth of population suffering with pain. And so at the same time that we have this advancement in technology, one of the advancements is the advent of the MRI. And the problem with the MRI is that it can't find muscular cords, can't identify them. So all it's doing is finding structural variations, which are independent variables, and treating those independent variables. Well, what happens to the muscular causes? They remain. The person continues to try to function, continues to have pain from muscular causes. And as a result, the pain becomes chronic. So the reason that we have chronic pain at this point is the fact that technology led to a greater population becoming more and more inactive, more sedentary, using their muscles less, sitting more, and becoming more susceptible to eliciting pain from muscle. The false use of the MRI to identify structural abnormalities, which are independent to the muscular causes, is what finally led to improper treatment and therefore the sustaining of the muscle eliciting pain, which is why we have chronic pain. How do you know this is true? Well, because nothing has changed in terms of the primary mechanism to identify the cause of pain. It's 40 years later, and we're still trying to follow the same premise. And at this point, 40 years later, we have 130 million Americans and roughly 1 billion people worldwide suffering from chronic pain. Clearly, something from its inception has not changed. That is the improper use of the MRI to diagnose the cause of pain. So that basically is the historical premise. And now let's look at what do we got here. So the points, the other point that I wanted to make. So that's the rationale why everybody's muscular. In terms of for people who are going to question this and say, nah, it's definitely the structure, I would point out two key symptoms that most people describe, certainly in my 28 years of doing this, thousands of people, including treating people in multiple countries by Skype and Zoom, the presentation always comes to the same outcome, that the person had pain, they sought care, they got some sort of diagnostic test, found the structural variation, got treated for the structural variation, have never gotten any better, tried a bunch of medications, maybe some treatments, and now they're on the internet seeking some alternative mechanism, and they find the Yass method, and that's how they come to me and finally recognize it's muscular. So with all these people, I always end up at the same point of saying to the person, just think logically. The person just told you that the pain at that side of the thigh and the front thigh is from your hip joint, it's from arthritis, that the arthritic process is the cause of your pain. Logically, think logically. If this process, which is ongoing and never ends, was causing pain, would you expect your pain to be continuous? The answer would have to be yes, because it's an ongoing process. It doesn't stop and go. It's an ongoing process. Never stops. The arthritic change that exists always exists. Therefore, if the arthritic change was the cause of the pain, it should always elicit pain all the time, continuously. And you would think that the intensity should roughly be the same. Shouldn't vary very much, right? But that's not how people describe their pain. They say their pain is intermittent during the course of the day. Some people will say that they have pain one day, it goes away for a couple of days, then comes back another day. Does someone think that that describes a symptom that would be created by an arthritic change? Of course not. It's lunacy. Same thing for stenosis, herniated discs, any of these things. Clearly, that's insane. Secondly, most people will say, what brings on my pain? Well, if I stand, if I walk, if I twist, if I bend, if I kneel, if I go upstairs, if I climb, if I reach, if I reach behind me, if I any of that stuff, it's always associated with an activity. So again, the question is asked, do you think that if there's an arthritic process going on, or a meniscal tear, or a disc, these structures that they're saying are the cause of the pain are somehow affected, whether you're bending, twisting? So basically, if you go upstairs and you're having pain at your knee from an arthritic change, then you sit down and you don't have pain, are you saying the arthritis is melted away by sitting? Sitting melts arthritis? Or if you bend and you have pain at your back and then you lay down and you don't have pain, so laying makes the herniation not be the herniation, or the stenosis, the narrowing is not stenosis anymore? That's what you want to believe? Again, complete lunacy. Complete lunacy. The other point I would try to make to people about the indication that things are muscular is that if you notice that the pain seems to go along with you limping, waddling, again, having difficulty doing an activity, altered movement, well, what tissue is responsible for movement? Clearly, it's muscle, not your kidney, your liver, your spine. It's certainly not your joint. Joints are responsible for range of motion. End of story. Activity is performed by muscle. So if you're associating and seeing some altered movement pattern like a limp, that's going to tell you that's a corroborating symptom to the fact that the pain is coming from muscle. What about posture? Oh, my shoulder is higher. I have rounded shoulder. I have an excessive arch. What about stuff like that? Do you think that that's not connected to the tissue in distress eliciting your pain? Clearly it is. A corroborating symptom of altered posture reinforces the point that the tissue in distress is muscle. I don't give a shit if some structural variations identified, some abnormality is identified. If you get pain and you notice that you're having altered posture along with that, the cause is muscle. You have to look at what's real, what's empirical, not some theoretical, nonsensical stuff that is easily disputed in empirical findings. What is what's real. So I just simply pointed out I've been treating pain for 30 years. The evidence is overwhelming that the MRI is baseless and the primary cause of pain is muscular, just like the overwhelming evidence was that the world was round, but for thousands of years it was believed to not be. Science always uncovers the truth, and it is happening every day. It won't be much longer before this becomes fact. That is my response. And hopefully, if this person gets to see this video, because it will be presented on Reddit, they'll be able to see all the evidence. So if you like this video, if it helps you understand what's going on, please give it a thumbs up. If you like my YouTube channel, Dr. Mitchell Yass, please subscribe to get notifications when new videos are added or when I am live on YouTube. If you want to contact me by email, you could do so by contacting me at my email address, drmitch@mitchellyass.com. Or if you'd like to set up a Yass Method Zoom session, you don't have to be in Jacksonville, Florida to get the Yass Method. It could be gotten virtually, as I've mentioned. You could do so by going to my website, livewithoutpains.com/sessions. You'll see how the sessions work, what to expect. And then when you're ready, you can pick a day and time that works for you and schedule your sessions. So for now, this is Dr. Mitchell Yass. Wishing you a pain-free, fully functional life. Bye-bye for now.